until you feel this kind of activate and engage, and almost until you feel like it's pushing your body forward. And really just kind of under that glute here, kind of right under that socket. Really the focus here is that you want to have the pelvis straight. I don't want you leaning forward because the band is pulling you that way, or kind of leaning. You really just want to try and have nice square pelvis for this. Bending your knees a little bit, totally fine. You're going to inhale, exhale, just hinge forward, keeping the abs on and engaged and not going so far that you feel like you're going to lose balance. Want to make sure that your big toe and feet are grounded into the floor. So we're going to do 10 of these each side. All right, bend forward. That's one. We're going to inhale, lean forward, and then exhale, stand up.